Hi, everybody. I am very honored to be here for just a quick session with y'all to talk about how in the credentialing space, we look at accelerating education to practice. And we'll talk about one particular initiative that the National Health Career Association has been involved with for a number of years now. But for those of you who might not know, I am the executive director of NHA. By historical reasons, we are a credentialing organization, actually the largest healthcare credentialing organization in the country. And we have actually issued over 1.3 million credentials across 8 different professions in which we have accredited exams. And we currently have over 389,000 active cert holders. So those are individuals that are maintaining those certifications and working, in a healthcare related field. So we're super happy about that. Our goal is really around helping our customers, clients, and partners shape the future of healthcare and get those workers into the workforce so that we can have a good high quality of care delivered to our families, our communities, and our patients. So I will get started here. So we're going to go through just a couple of high level areas. So skills-based education and training, which has been a key word, buzzword of what we've been talking about throughout the entire conference. Just briefly touch on accelerated learning and what that means. Then we're going to talk about the value of ACE credit. That's the initiative that NHA has been involved in. And then if we have some time, we can do some questions.
Sorry to interrupt, Jessica. The slides aren't advancing for us.
They're not?
Mm-mm.
It says I'm sharing my screen. Let me stop again.
Okay, we're good now.
Now? Okay.
Yes.
Awesome. Okay, so anytime that we are having a conversation around the credentialing landscape, I always love to throw these numbers up here, and as much as and as closely related to them as I am, it is still staggering when I look at some of these statistics. The over 1 million, credentials that are being offered across the country now by just an outstanding number of organizations and companies and things like that, and the numbers that are driving it, really. So 59% of employers are saying that upskilling and reskilling is their top priority for the year, especially focusing in on 21st century skills when they're looking to hire people. And then, as we have seen, the trend of reducing degree requirements for middle and high skills positions is on the rise, which is good when we talk about being able to bring value to education that happens in a non-traditional place, resulting in some sort of credential. Did it advance that time?
Yes, it did.
Okay, awesome. All right, so across healthcare, like many sectors, there's a strong focus on skills-based education and training. We know that a lot of times the training doesn't happen in a traditional classroom, which means that can go unrecognized or unnoticed, and they're not getting a whole lot of value from that. I like to use the example of when I'm going to date myself back in doing my medical training. The common practice was to have a training program in a hospital, so a hospital-based training program. And really the focus was less on, opening a book and learning content and memorizing information as it was to being delivered that information through more hands-on, active kind of learning, right, in a job scenario. We see that also when we talk about roles of nursing and like a licensed vocational nurse or a licensed practical nurse versus a BSN, where a BSN is going to have a lot of academic rigor in their program of study, but a LVN will place more emphasis on the bedside manner and the emphasis on practicing those skills and delivering that care to patients. So we know that when we focus on skills-based learning, that it does help learners close the gap. We sometimes call that the classroom to practice gap, or theory to practice gap. It is taking the place, as we know, of more informal education. And rather than spending a ton of hours on, consuming knowledge via PowerPoints or, things like that, they are learning in more ways, like problem-based learning, hands-on learning, creativity, critical thinking, all of those things. And even more so, educators are looking to align curriculum to more of that skills in order to meet industry and job market data and demand. And then, of course, the ever increasing skills gap, which is what we talk about across multiple industries. They are looking to develop their own internal education and training programs. And we certainly see that a lot in healthcare these days. We need skilled workers since we are experiencing a workforce shortage crisis in healthcare. And we are desperately trying to find ways to train people quicker so that we can get individuals into the workplace. So not only are we focused on skills, training, and development, but we're, as I mentioned, trying to find a way to do it better, faster. What that does when we look at things like credit for prior learning, embedding credentials into degrees, dual credit enrollment, which those of you in education are very familiar with those tactics, and that helps us save time and money. It personalizes the learning, it accelerates that training, and we can learn in different ways that is more beneficial. It also shows that we boost performance and have higher levels of success when we do that, and when we take into consideration past learning, life experiences, previous roles, and skills that they already are competent in and may not need to learn again. So I want to introduce you to the initiative that NHA has been working on for the past 4 years. We have been partnered up with the American Council on Education, and what they do as a plethora of the organization and their offerings, but they help give mobility to the higher education community. And they do that by connecting workplace learning or learning that's happening in other non-traditional areas with academic credits, so those can be transferred back to institutions of higher education. So they have what they call the Learning Evaluation Services. And what that does is it reviews a wide range of training. It could be military, it could be, something delivered through a non-accredited school or a workforce program, whatever it might be. Apprenticeships is another really common one. And so they do these program reviews. They have reviewed over 36,000 programs, which is amazing. And that makes them the national leader in evaluation of education and training obtained outside of the classroom. Now, they don't do that alone. It takes a lot of work from industry leaders, subject matter experts, academic professionals that volunteer their time to do these reviews. But it's certainly worth it as we move into that 21st century economy and the need to learn these skills and have them be obtained faster. To arrive to the ACE credit, they have a team that will go in and basically do an assessment. If anybody is familiar with, different levels of accreditation, programmatic accreditation, things like that, it's very similar. So they look at factors like development of either the exam or the course. They look at how the content is created and delivered. They also put an emphasis on the skill and the ability areas that are presented in the materials. They look at level of difficulty, and then of course validity of the information. They also take into consideration the reliability, and if it is a exam, it's heavily weighted on testing procedures, exam security, and things like that, which we know is really important today. So the examination evaluation is the part that NHA has taken into consideration over the last 4 years, and we have actually gone through the review process 5 to 8 different times. And of the 8 professions that we currently have accredited examinations for, 5 of them have been awarded ACE credit. Now, those credits, you're probably thinking, okay, well, why haven't all 8 of them done that? They have different levels of credit recommendation that can be awarded. If you can see here, they have a vocational level, a lower division or kind of associate or baccalaureate degree, and then of course an upper or baccalaureate or postgraduate degree. So they could fit into those categories based on content, rigor, things like that. So a couple of our areas are very skills based versus maybe more profession based. And so they were awarded a vocational credit versus an actual academic credit. But we do have 5 that receive that, and they range anywhere from 1 credit all the way up to 5 credits. So we're super happy about that. We're even more happy because it really helps individuals that are going through educational programs, are going through workforce development programs, or maybe going through military or employer-based healthcare programs. Then they come to NHA to take this national certifying exam, and they're getting an added benefit or bonus by doing that. So it allows those individuals who've passed our exam to add that college credit to their transcript. It can be used in the same way as a traditional academic transcript. They can take that to a college or university if they're working on putting hours towards an associate degree, or maybe they got an associate degree and now they want to move up into management or leadership. And so they can take those hours to hopefully count towards that higher level. They can also be used for continuing education or career development requirements. So let's say they were in a specific role within a healthcare organization and they wanted to do something different. So they took it upon themselves to go out, learn a different skill, pass a national certification exam, and can now use that to maybe elevate themselves, move along a career pathway or a career ladder within the system. It gives them higher pay and allows them to stay with the organization and be able to improve within. We have seen that this is the biggest benefit. We work a lot with secondary education, CTE, health science pathways programs. And so obviously dual credit enrollment is a big push in our high schools, but ACE credit is also accomplishing that same goal, so that when these students come out, they're more than prepared. Most of them are moving into their end or even the beginning of their second year of college with the hours or number of credits that they can transfer in. And so we've got a lot of feedback how hugely beneficial that is, whether they're going directly into the workforce or whether they've taken the health science career pathways to just be a stepping stone to maybe going on to a nursing program or some other health science career. So this is just an example. I have a link here. So ACE puts out a national guide, which actually will list every program based on a potential or a partnering organization. So when you go there, and if you put in National Health Career Association, you'll see our 5 that have been awarded academic credit pop up here on the screen. So for example, our certified clinical medical assistant, which is one of the most sought after and high demand, hardest to fill roles right now in the healthcare space. They do have a breadth of skills in this, both clinically focused and also administrative. So if you think of your front office, doctor's offices that are doing your insurance and your scheduling and all of that, And so because of that breadth of content, they've actually awarded 5 semester hours. What we typically see is our higher ed partners will integrate this into a capstone course to where they are reviewing or doing a final study session or study course to get them prepared to take their national certification, and the certification exam is often embedded as a component of that course. And so they not only get the credit hours that they're being awarded through the institution, but also in addition, the 5 credits that they get through the certification exam. 2 credits have been awarded for phlebotomy technician, 2 for EKG technician, 1 for patient care technician or assistant, which is also a very upcoming and in need role as well, but more in the acute care or hospital setting versus the medical assistant, which is in high demand in our ambulatory settings. And then 2 hours for our electronic health records. So obviously with this comes a digital badge, and the craze is here for digital badges, micro credentials, all of those things. And so what ACE does is they work through Credly, which I'm sure most of you have heard of. It's a really popular credentialing or badging company. And they actually award the transcript via a digital badge to individuals who qualify. So what that does, and everybody's probably very familiar with it, it has attached to it the competencies that come with earning that badge. In this case, it will outline the credit hours, the academic hours that have been awarded. It gives them the opportunity to share it digitally, and that's much more easy than trying to get a hold of our transcripts, as we know, through a registrar's office or some other process. It is a credential. It's secure when, there's only a one-way communication in terms of NHA being able to issue the credentials that Credly then communicates. And then it helps us see those direct connections between the skills and the jobs. So with that, just kind of in summary, and to give you just a little bit of a snapshot of what we have done. So in the last 3.5 to, I would say it's been, 3.5 years, that's the number of credentials that we have awarded that qualify for academic credit. You can see that the acceptance rate is 18%. And I know people are like, why would you share this? Look at those numbers in terms of the Credly average. We by far send the most credentials to Credly of any other of their partner organizations. So the conversion rate is skewed a bit from other organizations that are administering, similar credentials, but we do a lot in combination with Credly to communicate to our certification holders that they have this value and benefit there. But still 18% of 284, that's quite a bit. And we know that the share rate is growing as well. So we're glad to see that they're using that in the digital world to identify themselves, the skills that they have, and communicate that with employers or with those in the workforce. So we'll continue, obviously, to make sure that everyone takes advantage, or everyone who wants to take advantage of that, to increase that acceptance rate. But we're happy with how it's going. And we have plans to continue doing this and to do more in the form of learning resources and things like that, so that, again, the training that's happening in those non-traditional places gets recognized for credit and can use towards advancing their careers. That is all I have. If anybody has any questions.